Hello, everyone, and welcome to this audio podcast. This audio podcast is part of this series, the Storm Solar. This audio podcast is part of the Chartered edition and a Chartered edition and an evidence-based edition. This audio podcast as part of the Stellular Impeach, and this audio podcast as part of the Rupture feature and a Storm Robotics production. In this audio podcast, following on from the previous, this audio podcast will go into the methodology around this peer reviewed and sort of published works looking at understanding education for healthcare service users aligned to social media platforms, and this is a this peer reviewed and published and sort of anticipated for early 2024. This works looks at highlighting some descriptive data between pediatric and adult nephrology social media platforms. So in this collaborative works a little bit around the methodology. So the research team utilized or used a topic tagging activity wherein topics between two social media platforms were co-developed, having understood the aims and the remit of the social media platforms. The topic tags were co-developed against 14 different topics or themes, and the most um, uh, the sort of 14 different topics or themes, um, uh, where they were linked to the most popular terminologies having been extensively investigated over one during a pe- during the during March March 2020 to April 2020, over just over uh, a 1 month during a 1 month duration, and topics were tagged for 2 weeks per social media platform. So 2 weeks through the RPSG on the RPSG, the online adult nephrology population, online adult nephrology population, and 2 weeks through through KDARS, the online pediatrics or young people renal population, in context of these social media platforms supporting those varying forms of chronic kidney disease. So topic tagging retrospectively sought to help understand which areas of healthcare are had been popular, and also where patients between the two social media platforms would find health professional involvement supportive. Descriptive analysis will be used or was used to analyze data. In addition, conducting a 10-year and a 6-year retrospective descriptive analysis of topics and tags between the pediatric and the adult kidney care social media platforms, sought to help understand if there are healthcare educational inefficiencies, and identify what needs must be met in the care between pediatric and adult nephrology patients. Administration teams or the moderating teams between pediatric and adult kidney social media platforms sort of pinned an announcement at the top of the respective social media platform, so that members or service users would know. Number one, this is to help identify experiences sort of relating to related to themes and subject entities, and number two, to highlight how topic tagging activity is being conducted to identify discussions relevant to health focuses and scenarios, and three also to highlight how kidney care platforms or social media platforms help in searching for information surrounding ongoing care. In around this works, there was some uh, there is some there was an approach in context of the ethics an ethics process. So this works had undergone both academic and National Health Service or NHS ethics approval process, highlighting all aspects of research. UK General Data Protection Regulation or GDPR, UK GDPR or GDPR 2020 guidelines were also implemented to ensure best practice surrounding confidentiality, data protection, and compliancy. Information sheets and consent forms were produced to inform participants of the intentions and outcomes. All participant data had been collected outside the academic institution and housed on a secure server with firewall protection. The research protocol ID for this research was based and linked to the link to a remit in regard to the greater Greater Manchester South Research Ethics Committee, and healthcare service users between both social media platforms were informed of the topic tagging and confidentiality would remain within the social media platforms. Group disclaimers within the social media platforms also encouraged informed consent. Department of Health guidance was also sort of was consulted uh, was also consulted in synchronicity with the UK GDPR or the GDPR 2020. In the manuscript there is in the published works there is a sort of some detailed information in regard to the General Data Protection Regulation 2020 or GDPR 2020, where this works looks at where the guide where the GDPR looks at or highlights that in order to utilize data in order to utilize data, then the GDPR is utilized had to be utilized in context of compliancy this around this works. That draws this audio podcast to a close. This audio podcast as part of a Ztorm Solar. This audio podcast as part of a chartered edition and an evidence-based edition. This audio podcast as part of Stellular Impeach, and this audio podcast as part of the Rupture feature and a Storm Robotics production.